Bless you and good morning, everybody. What a wonderful day this is to be together here at the JLM Center. And we are grateful for all who already had their vaccine, those who are yet coming. And we are always excited to open the doors of JLM in such an occasion as this. And today is an exciting time to welcome and to greet our mayor of this city of Chicago, Mayor Lightfoot, and also to have today the CEO of Walgreens, first time here at JLM Center, Brewer. We're thankful to have you in the midst on today, and all of the elected officials, pastors and others who come help to make this an exciting time. I know we had to do a little push, a little arm twisting for some of you, but I'm glad you made it. Go ahead on, get on the phone, text, and tell others to come on. We're going to make it an exciting and an informative and a powerful day. A few months ago, when we couldn't come on the inside, pastors and faith leaders came together, community leaders, urging and asking to make sure that the hardest hit community would have an opportunity to receive the vaccination when it became available. And I'm excited today. Our mayor has pushed the partnership with Walgreens, and we are here today. She did her part. The Walgreens to come together, made it happen right here in the community. We'll be with Pastor Abercrombie at 2 o'clock, and we are thankful. And at this time, it is my delight to bring to you the mayor of the city of Chicago, Mayor Lightfoot. Come on, that's right. Give her a great big God bless you. Thank you so much.
You know, I have a lot of prepared remarks which I will give. But I want to say this to the people that are out in the audience, and hopefully the people that are waiting to get in. I want to thank you for taking care of yourself. Yeah. I want to thank you for taking care of yourself and your family, your spouses. I also want to thank you for taking care of your neighborhood, your faith community, and your city by being here today to get your vaccine. You know, as black folks, sometimes it's hard for us to listen. Yeah. You know, we talk about this all the time and talk about how sometimes God has to make us stand still so we can hear what He wants us to hear. And I truly believe that in this time where we are hard pressed, getting sicker than everyone else, dying more than anybody else, that it's important for us to be able to stand still and listen. You know this. Sometimes the Lord brings us a blessing that we don't expect, and it comes in a different form. And I believe that in this time where we have suffered mightily over this last few years, what we are getting in this life-saving vaccine is a blessing from the Lord that we must accept, we must embrace it, because it will truly mean the difference between life and death for us. So I know that there's reluctance on the part of some. I know that there's fears on the part of some. All kinds of myths about what will happen and what won't happen. But I'm here to tell you as somebody who got the vaccine. Yeah. I'm somewhere to tell you as somebody who encouraged the 92-year-old mother to get the vaccine, that these vaccines are safe. And they are necessary for us as a community to be able to go on and thrive and realize our God-given talent. We cannot do that if we are sick and we are dying from this vaccine. So my friends, my folks in the black community, in the brown community, who have been hardest hit by this plague in our midst, please, please get the vaccine. I want to thank Pastor Miller, and I want to thank all the other pastors on the west side who are here with us today, who I know have been preaching this gospel. But I want to particularly single out Pastor Miller. I have been here in this house, seeing Hatch come sliding in. Let's get a chair for our brother Hatch. I have been here in this house in good times, but in tough times. in times where we needed to come together as a community and have a reckoning over a tough issue, whether it was police reform and accountability, whether it was other challenges that we were facing. Johnny Miller has always opened up his house, always opened it up, made us welcome, given us a safe space to address difficult, tough issues. So Reverend Miller, I just want to say thank you for being a center of gravity, for being a convener, never shying away from a tough fight. That's who you are. That's who you are to our city, and thank you so much, Reverend Miller. Thank you. Now, I also will recognize at least one more person. We have in our midst today a woman who I know is going to be a game changer, not only for her company, but for our city. CEO of Walgreens International, folks. This isn't in the local Walgreens. This is the CEO of the whole company who is here with us today, demonstrating her commitment to saving lives throughout Chicago. Walgreens has been a tremendous partner for the city of Chicago throughout this pandemic. They have stepped up. They've gone to senior homes. They've gone to congregate settings. Wherever the tough assignments were, Walgreens said, send us. And they have been there for us. So, Roz Brewer, welcome to Chicago. Thank you so much for being here. And I would be remiss, we are here in Jason Irvin's ward. He could not be with us here today, but I also want to recognize another stalwart of the West Side, and that is none other than Congressman Danny Davis. Let me also give a shout out to Illinois State Senator Patricia Van Pelt. Thank you, Senator, for everything that you have done. Also standing with me here today is Karen Wilson Freeman, now the new leader, the dynamic force behind the Chicago Urban League, my friend and partner. Thank you so much for being here. And I also want to recognize the woman whose shoulders I lean on, that I have really relied upon throughout this year plus of pandemic, who has been a voice of calm, who has steadied us when we have felt weak and shaky, who is always straightforward, telling us like it is, but doing it in a way that we can take our sometimes bitter medicine, and that is our great Commissioner of Public Health, Dr. Allison Arwin. Now, ladies and gentlemen, since the day that COVID-19 first arrived in our city just a year ago, it was clear that we would need to take bold, transformative action to protect our residents and our communities, especially those who are the most vulnerable, and to address the systemic inequities that it brought to the surface. You remember just a year ago, I stood before you and talked about the fact that black folks were dying at 7 times the rate of any other demographic in our city. We had to step up in that moment. We could not accept that. It's just a fate that we were going to be laid low with. So we brought to the table a series of solutions. We reached out to people in our community asking for help, and we have turned this around. Now, with this life-saving vaccine, more work to be done, but I promise you, even after we have this pandemic behind us, we are not going to shy away from continuing the hard work to take on these systemic inequities. It's not acceptable in the time of 2021 that black folks have a life expectancy 10 to 15 years less than any other demographic in our city. It is not acceptable that our people still do not have access to high-quality health care. These are the challenges that we must come together and face as a community. And if you're willing, I'm ready to lead this fight. And And as a result of the unprecedented collaboration that we have forged with leaders like these who are here on the stage, members of the faith community that are toiling in the vineyard every single day and have been for decades, we have made incredible progress in our fight against this pandemic. And core to our ability in making that progress and actually shift the demographics and the numbers that we've been seeing is making sure that all of our residents have access to the COVID-19 vaccine. Now, it wasn't easy, and it still isn't easy. But in the first few months that vaccine was here in our city, we saw devastating numbers. Even though Black and brown people make up over 2/3 of the people in this city, we were seeing uptake in the high teens total. 10% Latinx, 8% Black folks. Reluctance to take the vaccine was very rampant and reflective of the deep distrust that Black and brown residents have had for decades in our government, in healthcare system, due to the historic role that each has played in perpetuating systemic racism and other attacks against who we are. To combat this, we knew we needed to meet residents where they were, to listen and understand their concerns, their fears, and to work with them to assure them that the vaccine is safe. And over time, with targeted engagement strategies from our community partners led by our community, and of course, including, importantly, our faith leaders, and city initiatives such as Protect Chicago Plus, we have been able to help move the needle so that more of our residents understand that the vaccine is safe and that they can get access to it in their neighborhoods where they are. It's in the same spirit of collaboration and determination that I am thrilled to announce that today, in partnership with Walgreens Boots Alliance, we are kicking off the Faith Initiative here in Chicago. Over the next 3 weeks, more than 10,000 residents from more than 70 different houses of worship. Can I get a little amen on that? 70 different houses of worship across our city will be vaccinated at 13 clinics run by Walgreens. This effort is part of Walgreens' Vaccine Equity Initiative, which will further increase equitable access to Walgreens, provide education to address vaccine hesitancy, and foster partnerships that meet the needs of our communities. Beyond Chicago, the Vaccine Equity Initiative will also result in the hosting of off-site COVID-19 vaccination clinics in more than 100 underserved communities across the nation. That's the commitment that Walgreens is bringing to the table. The expansion of access of COVID-19 testing at more than 5,000 Walgreens pharmacy locations, more than half of the sites created in vulnerable areas across our nation. Community partners like faith leaders and providers like Walgreens have long been trusted voices in our community, core to our ability to drive vaccine into the communities that need them most, and showcase the necessity for leaders to look like and share similar experiences as the residents they serve. It's not lost on me that this Vaccine Equity Initiative is being led by someone who is the first Black woman to serve as Walgreens Boots Alliance CEO and the only Black woman to lead a Fortune 500 company. Folks, you know this. When we are at the seat, when we are in the table, when we are setting the agenda, we make sure that we take care of the people who have been left behind. And as Chicago's first Black woman mayor, supporting residents who look like me, who have had the experiences that I have in life and share, is a commitment that I unapologetically embrace. I will never be sorry for recognizing that the city of Chicago extends south of Roosevelt Road and west of Ashland. I am excited, ladies and gentlemen, and I want to thank these faith leaders for trusting in a partnership with us at the city to help save the lives of their parishioners, but also the lives of our residents who have been left behind for way too long. You've heard me say this often over the almost last 2 years that I've been mayor. We cannot be a great global city if our neighborhoods are starving. We cannot be a great global city if black and brown boys and girls do not see their destiny in this great city. They don't feel opportunity at their feet. We can't solve the problems of today and tomorrow if we don't start now and lead with equity and inclusion. And with God's grace, we will get it done. It's now my pleasure, ladies and gentlemen, to introduce the Walgreens CEO, Roz Brewer.
So good morning.
Good morning.
I cannot believe that the city of Chicago has this amazing mayor that is also a faith leader. She sounds just like she's running this whole facility. I can't believe it, but thank you so much. And to Pastor Miller, thanks you for everything you've done in this community to help get Chicagoans vaccinated. So it's been an incredibly challenging year for all of us for so many reasons. When this pandemic hit, it hit us the absolute hardest. And guess what? We were already weak, right? This came on the backs of everything that happened in our community. When what happened to George Floyd happened, and then this pandemic hit, it was a double whammy to our community. We weren't emotionally ready for this, we weren't physically ready, but you know what? It's days like this that give us all hope, gives us the belief that we can make change happen, and it happens with all of us in this room. And I'm deeply grateful to join this company and be a part of something that I'll have to tell you, quite honestly, I dream for moments like this in my life. I was born and raised just across the lake in Detroit, Michigan. And I'll tell you what, it's a lot like Chicago. So, I feel so much like I'm at home. Yeah. And right next to us is Gary, Indiana, where my father spent a lot of his time and where my first cousins were born and raised. And my first cousin worked with Karen Freeman. And, it's times like this that I say it was worth everything I did to sacrifice my family to get to where I am in my career, because this is everything I want to do. So thank you for having me here today. I'm really excited. So for partnerships like this in local governments and communities, this is exactly what it's going to take for us to get better. These 4 clinics today are a fantastic example of what we want to do at Walgreens. I think about the work, we could be doing a lot of things right now. This company is faced with some really big issues, and they're global. But right now, what's so important to us, and I've said this to everyone, is that I'm coming here at a certain time. I'm going to come here as fast as I can, and the first thing that I will do is get my arms around this vaccine execution. Because if Walgreens can't get this done, we don't need to do anything else. This is important. This is who we are. So Walgreens has been and continues to be deeply committed to doing their part. We're helping to address other issues in disproportionately affected communities. We're also helping to address issues like pediatric asthma, that's important to us, sickle cell, which faces our community, diabetes, pneumonia, and those are things that when you walk into our pharmacy, and our pharmacist can look at you and ask you 2 questions. How are you today? And if you're getting a certain prescription filled, have you thought about getting your vaccine? And if they haven't, we can tell them where to get it, and we can sometimes tell them, have a seat, we'll give it to you. That's what we do as a company. That's why our pharmacists are the best in the world. I'm so proud of them, so proud of them. So, I've been doing my research on Chicago as I'm moving myself and my family here and learning more and more about this great city. But one of the things that I've really been thinking about is that, so what does health equity mean in this city? And there's some programs that have really caught my attention. And I look at the program and the work that we've done over the last 12 years with the First Lady's Health Initiative here in Chicago. It's amazing. And this is a chance for our faith leaders and their spouses to come together and have that very important conversation around who's at risk, right? And if you can't believe your faith leader and their spouse about what needs to happen in your life, that's who we listen to first. That's how we were raised as a community. It's a fantastic program. I'm very proud of the work to keep our pharmacies in the mix of everything that's going on here. Throughout the pandemic, we have mobile units that we hopefully can move around the city. You'll see us do more and more of these mobile settings like this. We'll be with tons of churches. Like the mayor said, 10,000 people over a period of just a few short days. But what we need from all of you all in this room is to tell the story. Tell what it was like to come in here in the morning, have someone greet you, have someone take you to a sitting room where you feel safe and sound, and you know that you're being taken care of. We need you to spread the word. People are still apprehensive, and like the mayor, I too have had my vaccination. And when I got my first shot, I sat in my car, I took a deep breath, and I said to myself, someone just saved my life, right? Because I'm part of that community that lost family members, right? I met one of our Walmart employees, I'm sorry, Walgreens, I worked with Walmart too, but Walgreens employees. And this was during the time when I was just driving around talking to stores before I took my position. I had 2 weeks. I drove all around from the state of Georgia to South Carolina and all around the Southeast. I met one of our employees. She lost 21 family members to COVID. She missed no work. She came to work every day because she said, if I come to work every day and enable these vaccines to get executed, no one else will have to do this. She went to one funeral with 3 of her family members at that funeral. 3 family members in caskets. That's the kind of stories that we don't want to hear, but it's happening to all of us. So this is encouraging. We need to grow this. You've got Walgreens' commitment that we're a part of this community. We are replicating this across the country. Chicago means a ton to us, but there are other communities that look just like this. And so let me just say to everyone, thank you for making this a priority in your lives, taking care of your communities, your household, and Walgreens is here to help whenever you need us. Thank you very much.
Good morning. Allison Iwardy. I'm the commissioner at the Chicago Department of Public Health. And I just want to say I have a lot of opportunity to go to these events, and every one of them makes me so happy because every one of them takes us one step closer to being past this pandemic. And I want to thank first, thank you. I want to thank first the faith leaders, because I know how important your voices are in terms of building confidence and making sure that people who maybe aren't first to raise their hand to get the vaccine make that decision when it's an opportunity. I also want to thank Walgreens, who are the largest provider in terms of the number of vaccines that are given here in the city of Chicago, and their commitment to equity and really making sure we're getting vaccine to the settings where it's most needed. And then finally, I want to thank the political leaders, and especially Mayor Lightfoot, who has pushed us every week to say we can do better. We can move vaccine faster, and we can move vaccine to the communities that have been hardest hit. It is no secret that Black and Latinx Chicagoans have borne this burden, and I want nothing more than to see the highest vaccination rates in our Black and Latinx communities. It's going to take all of us sharing the information about the safe and effective vaccine, and I can't thank everybody enough for all of you who are here doing your part today. And with that, I'm so pleased to bring up Congressman Danny Davis from the state of Illinois.
Thank you very much. You know, I've been thinking all week that when you do the right thing, you get a chance to hang out with powerful women. So I've been home all week because of the Easter recess. So I've been hanging out with Vera Davis, my wife. But then a couple of days ago, I was with the mayor again, and Dr. Arway. And now here we are this morning, and I want to thank Reverend Johnny Miller for giving us the opportunity to be at the JLM Center. A lot of things about black preachers that a lot of people don't know. It was black preachers who came up with the idea after the Civil War, after black slaves had been freed. 40 acres and a mule came from black preachers. Yeah, it didn't just come from up in the sky or something. Black preachers came up with that idea when they asked them, what do we need to do to help these newly freed slaves? Say, give them some land and something to work it with, and they can take care of themselves. I am so proud of the mayor of the city of Chicago, who has been an outstanding leader, not only in making sure that we get the coronavirus under check, but to try and make sure that we bring equity to neighborhoods in our city, in our community. Madam Mayor, it's always good to work with you. It's also good to work for you. And it's good to know that you got our backs no matter what comes up. The last thing that I will say, and I had my shots at least 3 months ago. I had them when they first became available. Because I know what health means. Health is wealth. And as much as I like the Miller brothers who are preachers, they got one who's a physician who works with us in health care all the time, Brother James, and we keep on doing it. I'm wearing my Joe Biden cap. Now, why am I doing that? Well, you know, the other day we actually passed a bill, $1.9 trillion. $1.9 trillion. 940 billion of those came out of one of the committees that I work on and serve on. So we've got vaccine flowing all over the country, not just in Chicago, but all over America. Trucks are loading up, delivering vaccine. Of course, the federal government is paying for it. Money got to come from somewhere. Walgreens, I must say, has just simply been an outstanding business in our community. I've been there so many times they think I got stock. And I like the idea when you walk in, there's someone there saying, good morning, welcome to Walgreens. I wouldn't intend to buy but one thing, but I think I'll buy 2 or 3 now. So it's a pleasure to be here with all of you, with Senator Van Pelt, my colleague, and the former mayor of Gary, Indiana, where my cousins lived and was involved in politics, the Allens, Doge Allen, all those folks. We didn't know we were cousins. But make sure you get your shot. Tell your children to get your shot. Tell your neighbors to get your shot. Because if you get your shot, then you don't have to worry about shoot. Senator Van Pelt, your turn.
And I got to come behind that, okay? Well, I'm just honored to be here today, and I'm just so proud of what Mayor Lightfoot is doing now, leading the way in this area, in this issue. I mean, she has a lot to do, but she's here because she cares about what's happening in our community. And I'm so happy that Walgreens has stepped up, Brewer and Walgreens has stepped up to lead the way and really to push for the kind of changes that we need in our community. And that means, like they say, if you can't get Muhammad to come to the mountain, then you need to bring the mountain to Muhammad, right? So if you can't get people to come out for the vaccine, bring the vaccine where the people are. And where's that? In the house of God. So we're just grateful to Pastor Miller. There's been such a blessing of tremendous support to all of us in this city and in this state, and I'm just proud to be here. And I just want to say, you know, Walgreens has stepped up. We're so happy about that. Mayor Lightfoot in her position has continued to step up. But I want to tell you who has always stepped up, okay? And that's the black church. The black preacher has always stepped up. And if you ever want to get a message to the black people, you need to go through the black preacher, because that's where we go for deliverance. That's where I got my deliverance at, in the house of God. And the black preacher was preaching. And this is where we get our hope, to believe that, hey, if we just keep trying, something's going to happen. Change is going to happen. And this is where we get our education, where we learn the things that we need to do. And so I got my vaccination when I saw the pastors was getting all their vaccinations. I'm like, hey, what I'm going to wait for? They all getting theirs. I'm getting mine, and my mom got hers. I'm just blessed to be here and blessed that to be a part of what's happening right now. I took my mom out, Pastor Hatch, I took my mom out to Uncle Julio's just the other day, went and got her fingernails done, and I also took her out to the fudge pot and got her some chocolate. You know, I haven't been able to touch my mama in a year. In a year, I have not been able to touch her, to hug her, to hold her, to let her know how much she means to me with my feelings, with my touch and my hands, and just speaking to her. I haven't been able to do it, but now I'm able to do it. And you know what? What Walgreens is doing right now, and what the mayor is doing, Mayor Lightfoot is doing right now, and all the black preachers, we got hope, y'all. We got hope. We got hope that we're going to come back to where we were before, where we can reach and touch our family members, where we can worship together, where we can shout together. And I just want to put this out here. I'm the chairperson of the Illinois Senate Health Care Committee on Healthcare Access and Availability. Healthcare Access and Availability. That's why I'm the chairman now of that committee in the Senate, in the Illinois Senate. But you know what I wish I was over? Appropriations. Because I think all these black churches need to be funded, because they are serving a need that nobody else can serve. Nobody else is positioned to do what y'all can do. So they always want the black church to do something free. Give us some, we don't have no money, but we give us something free. The black church needs to be funded and supported, because you all are filling in a gap that nobody can fill. So I'm grateful, happy to be a part of this, and just God bless you, and we're just going to keep doing this great work that we're doing. And right now we're going to have Karen Freeman Wilson, who is the CEO of the Chicago Urban League. Let's clap our hands for her as she comes.
Good morning. Good morning. To Pastor Miller, our host, and all of the members of the clergy, to Mayor Lightfoot, Senator Van Pelt, Congressman Davis, and all of the elected officials, to our CEO superstar. You know, this isn't something we need to take for granted. We've got a sister running the Walgreens Boots Alliance. That's huge. And to all of you, it is my privilege to greet you on behalf of the Chicago Urban League. For over 100 years, we have been fighting for civil rights in this community. And I'm here to tell you today that health, access to health care, is indeed a civil right. And so we are excited to partner with the city, to partner with Walgreens, to ensure that our community is educated and that they have the access to the COVID-19 vaccine. And the reason we want to do that, the senator has already alluded to that. But I want to tell you about my personal experience and why it's important. About a week ago, on Maundy Thursday, I went to church in person for the first time. And you know, on Sunday morning, I go from screen to screen, visiting services all across the country, because we can do that now. And I thought that my spirit was being fed. But when I walked in church, there was a feeling like I had never been there before. And I said, that is why this vaccine was important. And then on Easter Sunday morning, while I didn't get to go in person, I had an opportunity to worship and to celebrate the resurrection. And then on Sunday night, I don't know how many of you were on IG with me as we saw the Isley Brothers and Earth, Wind, and Fire on the verses. And then I had an opportunity to talk to a colleague yesterday who said that for the first time in 9 months, his small children saw his parents, their grandparents, and it was like Christmas morning. These vaccine sites that Walgreens is standing up, that we are seeing all over this community, are oases of hope for our people. And the Urban League is humbled to be in a position to deliver that with all of you. Thank you and God bless you.
Happy to take your questions. Now, I'm going to tell you right now, given the feeling that's in this room, be nice, man.
I'll do my best to interpret that. Can you hear me? Okay. Hi, Jesse Gers from Channel 7, Mayor. Appreciate your time.
Can we pump up the volume a little bit, folks?
Okay. Just back away from
There you
everyone.
go.
Okay,
That's
thank you.
better.
Hi, Jesse Gers from Channel 7. Appreciate your time. So you talked about we're narrowing that gap in the city, and you look at the inflection points of the first dose percentages, Black, White, Latinx, and other groups. The gap narrowed, but then late February it looked like that gap started to widen again. Is this effort a direct response to that? What triggered this effort? Because you've often talked about equity being the city's strategy for vaccination. So how long has this been in the works, and how does this tie into that inflection point?
Well, this going into the faith community obviously has to be part of our strategy. As you've heard, and you probably know, hopefully from your own experience, you can't talk about the Black community and not talk about the church, right? So we have got to partner with members of the faith community in order to make sure that we are driving equity. There are key stakeholders all across the city in every neighborhood, and in majority Black neighborhoods, one of the key stakeholders, of course, is the faith community. Now look, we know that we have made significant progress. We've seen the numbers come down in case infections, in hospitalizations, and in deaths that had been disproportionately affecting people of color in the city, but our work's not done. The underlying healthcare disparities that make people that look like me and have my experience more at risk because of comorbidities, whether it's diabetes, heart disease, asthma, upper respiratory illnesses, those remain real, and we haven't solved those problems. So we're going to see an ebb and a flow. But as I've said many, many times, and I'm going to invite Dr. Artie to put a little finer point on this, what COVID-19 has done is laid bare for all to see, not just members of the health community, not just members of the local community, but what it is laid bare for all of us to see is the decades-long disparities that have led to life expectancy gaps, the gaps in healthcare access. And I've told my team from day one, we're not going to build temporary scaffolding over these deep-seated challenges that are affecting the quality of people's lives, whole families' lives. We've got to build a foundation on which we can generate transformational change in the way that we do business in everything that affects the family and individuals in our city. So I think we've laid a good foundation from that, from the network of partnerships that we've created and deepened that didn't exist pre-COVID, from the number of federally qualified healthcare centers that are now part of a network and opening up their doors in a way that we hadn't seen before. And the monies that are coming from the federal government, I think, really give us an opportunity to expand that community healthcare network exponentially. We've got to be smart again. We've got to follow the data, but always, always, we have to lead with equity. Allison.
I would just add that as vaccine supply continues to expand, we add on to what we've already been doing. So in phase 1B, where we were very focused on seniors, you might recall March was a real focus on seniors. We're not stopping that focus on seniors. We're at 60% of Chicagoans over the age of 65 have gotten a first dose. That's good, but it's not good enough. And so building onto what we need to do more, especially with seniors, as we open up eligibility to everybody here in the month of April, the faith community is such an obvious and important partner in terms of both continuing to say, let's get not just Chicagoans, but some of those older Chicagoans who are often very connected to their faith community in with their families, with their communities. Protect Chicago Plus, very much of a neighborhood focus when vaccine supply was really limited. As more and more is here, and we've got more opportunities to bring vaccine into communities, and we have the one-shot Johnson & Johnson vaccine, it gives us a lot more opportunity to do events like this in partnership. We remain very committed and have continued to really outpace really every other large city on equity when it comes to vaccines. We're lagging a little bit in the Black community, and it's where we really want to double down.
I'll just follow up with you, Dr. Already. We're continuing to see that supply hopefully continue to increase. Do you think this is the last big strategic effort that you just keep pushing on, or are there more already in the works beyond this to continue with that equity?
Yeah, there's many more in the works. So really every single initiative that we set has an equity focus on it. And for example, last week we stood up Chicago State University as one of our first very large South Side mass vaccination site, and our first one that had that Johnson & Johnson, because we've heard a lot of people are interested in that one dose. You've heard us start with pilots with the vaccine bus, where we are literally driving down bus routes and parking and in ways that don't require appointments. We've continued to work with a lot of the community-based organizations, and every single week we look and say, where are we seeing vaccine rates lagging in Chicago? How do we push additional vaccine to providers? How do we push additional vaccine through events? And then with partners like Walgreens and others, calling in anybody who hasn't gotten care yet, who normally is at a pharmacy or at a clinic. So we have a lot of strategies. It's just vaccine supply. And as that ramps up, I'm really confident that the demand is there. And as long as that vaccine confidence keeps growing, I'm convinced that we're not seeing a softening yet in terms of people wanting to get vaccine.
Thank you. And then I had two quick questions for the CEO from Walgreens.
Can I just add one other thing? The one area where I will say that I think we still have a lot of room for growth is 18 to 39-year-old Black individuals, men and women, 18 to 39-year-old. And pastors, I'm going to give you a little bit of text for your sermon. Please speak to the young people in your churches. This is an urgent need. Where we look at the data, that is the one group where we're not seeing the kind of uptick that we need for vaccine. So anything that you can do to aid us in that work, 18 to 39-year-old Black and brown folks, Black folks in particular, that is an area where we've got to reach those folks. We've got to bring them into care. Thank you. Brad.
CEO Brewer, hi, thank you. So two quick questions for you. One is on this effort, and I'm sure it applies broadly to what Walgreens is doing across the country. Can you speak to the company's commitment in terms of resources? Obviously, it's no simple thing getting all of your pharmacists here, the shots themselves, all the materials that go with it. Can you talk about the sharing of resources between you and the city? Is any of this donated by the company?
Sure. So, what you see here, you'll see the pharmacists that are here. These are our pharmacists. They are sharing their time from our stores to here. So this is us really donating labor hours to this effort. We've made it a priority. And I'll tell you, we've got more of these coming, and you'll see us throughout the city and actually, across the nation doing these in the communities that matter.
And then the other question for you, you talked about sites like this, mobile buses. Yes. Obviously, one of the storylines throughout the vaccination effort across the country has been vaccine or pharmacy deserts.
Yes.
Can you just speak to what you've seen and in coordinating with this city and with others around the country? anything going on in your head about, maybe changing priorities for the company long terms in terms of where to put the next shop when you go brick and mortar?
Right. So that is something that I worry about, are the vaccine deserts. One initiative that we have is our partnership with Uber that will take people to other locations when they don't have a location right there in their neighborhood. So that's one of the things we're doing. And if we can get more of our vehicles mobilized, we can drop those in those areas as well and begin to vaccinate right there on the spot and not set up a center like this. So this is going to be our effort throughout. You'll see us grow this through the month of April, especially when it becomes a broad distribution. So we've been doing our best work in terms of what we can do as a company.
Okay. All right. Question from Channel 5 here for the mayor. Just curious, what sense of urgency, if any, is there to release the police shooting video in the Toledo case earlier than COPA's 60-day deadline to the public? And regarding that, what preparations can you share the city is taking for possibility of protests or any unrest once that video is made public?
Well, my hope is that we are going to follow in the long tradition that we've had in the city of peaceful protest. The Toledo family, I think, has been outspoken in calling for peace. This is obviously very, very difficult moment for them. I had the honor to speak to Mrs. Toledo recently. I've been in contact with her as she's been moving through the toughest week that any mom could ever have, which is a wake and then a funeral of her 13-year-old son. So in honor of what the family is saying, I am hopeful that people will continue to act peacefully. Certainly, we honor and support people's First Amendment rights to express themselves, but we've got to do it in a way that's peaceful. Regarding the video itself, a lot will depend on what Ms. Toledo wants to do. I think that, and I've been very clear about this from day one, that transparency always matters, particularly in something as significant as a police-involved shooting. But I'm going to be respectful of what Ms. Toledo wants to do. She will have the opportunity to see the video along with her counsel early next week, and then we'll go from there. We're going to hopefully follow their lead in this. But I do believe there is obviously a significant amount of interest in the video. I think it will only help disabuse a lot of urban myth that has sprung up in the void. But I want to be clear, from what's been described to me, it is going to be a very tough video for people to watch. And I would just say that we need, and this is really for folks in the media, to be thinking about when the video, or if the video, but when the video becomes public, how you are going to use that in educating the public about what happened. This has been an extraordinarily tough year. It goes without saying. We all recognize that. The trauma in our city is very real. People are carrying burdens that they never expected to carry in their lives. And so in that context, we have to be mindful, respectful, and intentional about the way in which we are communicating other tough things that the community has an interest in, but it's going to be a tough burden for people to bear. But as I said, we're going to follow the lead of this mother who is going through a tragedy that none of us have ever experienced, but too many people in the city have. And I just pray for her family, and want to continue to do everything we can to support them in this tremendous loss. As we have victims, unfortunately, across our city, we've got to do more to step up and respect and recognize the victims of all stripes who have suffered mightily from a range of different challenges. Say it again. Well, we have been starting preparations because of the Chauvin trial. That's really what our focus is. My hope, again, is that we will see peace, whether it's related to the Toledo case or whether it's related to the results of the Chauvin trial, which clearly is the evidence is going in faster, I think, than anybody initially anticipated. And I think there's a better than even chance that case could go to the jury late this week or early the next. But in all of these things, peace has to be the word that we not only say, but we embrace as a city. We will be prepared. We are prepared. We've been preparing for quite some time. But my hope is that people will embrace peaceful expressions, whatever their sentiment is regarding the Toledo case or the outcome of the Chauvin trial.